We forward to a next speaker, a last speaker for this webinar, Professor Felix Wong from Hong Kong. He will talk about how introduction of Hong Kong HIFU Center, and also he will give some surgery video for the HIFU. Okay, Prof. Felix Wong is conjoined professor of the University of New South Wales, chairman of the IMIGO, and foundation chairman of China, Australia, Asia Pacific Forum of Minimal Invasive Surgery. Professor Felix Wong is renowned for his contribution to medical education in Asia Pacific countries. He made up to 10 overseas every year to Asia Pacific countries and offer teaching in the areas of gynecology oncology, endoscopy, women health, and hospital administration. He also received awards from Endos Award in Medical Science and Technology China, Ho Chi Minh City Badge Award, the People Committee of Ho Chi Minh City, Medical Ambassador, Gynecology Endoscopy Group of Chinese Medical Association, Endoscopy Award, China's Government Evaluation Committee of Endoscopy, and Guangdong Friendship Award, Administration for Foreign Export Affairs of Guangdong Province, China. Okay, Professor Felix Wong, it's time is yours to talk about HIFU in Hong Kong. Prof. Felix?
Yeah, and coming. Sorry, trying to set up my slide and okay, everyone see the slide? Thank you, Chairman, for your introduction, and thank you for everyone to stay behind so late. And quick and Hong Kong HIFU Center. I'm going to share my experience in how to set up my center in Hong Kong. First of all, when, where, and how it started, all this happened. And it was an unusual opportunity and chances that in 2017, I met up with the founder of this HIFU machine in China during one of the conferences in China. I visited his Chongqing HIFU Medical Technology Company Limited, and I was impressed with the development he had with the HIFU treatment, as well as the way he provided teaching in the center, and as well as the treatment of his patient. I visited the center. I found that there's a well-established high technology company with great potential for our gynecologists. And this will be the present large factory and center. Now, in order to provide the HIFU ablation service in Hong Kong, I have planned the design of the HIFU center, learning the technology, establish the center, and promote the HIFU. And the centers I visited are many places in China. Also, I visited South Korea, as well as Taiwan, and to see various other places, how they set up the HIFU center. You can see different HIFU center room on the side. Now, I find that the issue identified is doctor and patient communication in this one is too far away. And if teaching may affect the patient privacy in the other one. This one is too dark. You may not be able to see each other. And this is too crowded. And this one, the space is too large. And as well as this one, just like an operating theater. So I identified some of the problems that I'm going to set up my center, what it will like. And our friends, of course, together, we all try to learn this technology, including a few you may know, Professor Janen. And so I have no confidence until I visit Korea and a television interview. And I visit Korea, and I find that Korean had a lot of day surgery clinic with HIFU treatment. Because in Hong Kong, I probably want to set up a day surgery center, not in the hospital, but in a private sector. Now, that's how I begin. And the location will be in one of the old building, prestigious building for the medical. Inside is an old building built in 1958. Foundation stone, 1957. So it is in the center of Hong Kong Island. Now have to see the select the HIFU machine. And finally, I choose the JC200 because that will be suitable for my small room I'm going to use. And the JC is a bigger machine, even though they can do cancer surgery, other surgery, will be suitable for hospital. But for a private clinic, that's what I choose, JC. What are the problems, or what were the problems? How I set up the machine? I need to consider the building, the size of the building, the space, the weight bearing of the floor of an old building, the water pressure, the ceiling height, and the lift. You will see my problem is that it's a very busy district where my center is, crowded with people. I got only a room of 60 meters square. So I use half of it for the theater, the other half for other facility. For example, waiting room, consultation room, the learning room, change room, recovery room, preparation bed, and the theater. And why? Because Hong Kong, the rental is very expensive. Even this small room will cost me 15,000 US per month. Besides, there's no bigger room for me. This 62 years old building, we worry about the floor weight. So we need a steel plate to share the weight of this machine. The water pressure, you can see the water pressure is so high, we have some filter early on got broken because of the pressure. You can see we have to wash. And the machine, you see the floor is really just able to build the machine. So you can also, if your floor height is really too low, you can use the new machine JC200D. Now the lift, a small lift from an old building. We need to break the machine down into very small pieces and to carry it out and then rebuild it. Finally, we got everything ready and for the decoration. There's now the pictures or video of my center. You can see it's not like any traditional operating theater. It's very friendly. So all my patients love it. So I use this space for the theater. We need essential features, for example, medical consultation room for the patient, sign consent. I allow doctor to learn from here instead of crowded together in my theater. There need to be a change room, the recovery room, and also space for storage, oxygen, washing, cleaning, and medicine storage. All this need to be in your mind. Now, that is what the center look like, change room, reception room, and there's the consultation room, preparation corner, the learning observation room. I mean, doctor can stay here to see what we are going on. It's the one-way mirror so that you can see inside, the patient can see there are people there. And also this inside the theater. I learned one thing, is the light seems to affect the mood of the patient. So I use some LED light from New Zealand. they can offer different color, just like karaoke. So the patient won't feel that they are in a theater. Like in the traditional theater, you can see different color will make them more relaxed. Now you can see I turn on 2 color. The patient went into the surgery, they may thought they are in a karaoke. And for people who are watching from the observation room, they can see us operating as well as they can see all the actual pictures when we are doing it. We can have communication. The learner can learn and we have all the pictures. So, but we keep the patient privacy intact. Now, I also have a facility. You can see this is a 360-degree camera. So this camera allows us to be able to see the whole picture. But when I put a camera behind here, and you can see not only the operating, we can see them, but people, when they are bored, they can look around to see the nurse, to see what's operating. Because I learned from laparoscopic surgery, we all look at the television monitor. We are quite boring. So a 360-degree camera will help us or help other people when they are watching, can see elsewhere. Now, another features I have is to be able to monitor the patient temperature at the bottom. So when we are doing the ablation, we are recording the temperature all this time, instantly. So I find there is certain very interesting features. When you burn a fibroid and burn an adenomyosis, the temperature that radiate to the bottom are quite different. So in those days, my nurse is recording, and while the patient is having the treatment. Now, what I find that now I put it in front of me so that I can watch. And this is what patients who have ablation done for adenomyosis. I found that the heat spread in many directions. But for a fibroid, more on the right side, and you can see the temperature can rise higher and higher. I noticed that once it lasts for quite some time, the patient starting to complaining of leg pain or back pain. I need to move or stop. So very interesting infrared monitoring, just like when we are checking our temperature everywhere. So of course, my center have the various things other than the lighting, the wall, and we have monitor, we have security, we have the alarm and communication system. So this is the center where we have all this facility, just like facility with the traditional theater. Then we're starting to get doctors to China to learn from Chongqing. And when thing is ready, and we're starting to check the machine, get everything started. Now, my center, how to promote it? I talk to various people, and in lectures, our colleagues in ONG, and receive television interview, and visitor from overseas. We have distinguished VIP and expert from China visiting my center, as well as patient, their relatives are joining them during the treatment. So I allow patient relative to join them, the mother, the husband, or even the friend. They sit next to them. So it's not only the patient admires of this treatment, the relative is going out and speak to all these other people. The most important are the patient. Once they receive the treatment, they agree for us sometime to tell them the expression, the impression, the experience, how the problem being solved. This is the number of patients we have treated. And when we first started, Hong Kong had some crisis. There's political crisis. However, despite the COVID-19, while the hospital are short of patients, our day surgery center, the number is increasing. However, lately, we might be too successful. The insurance company is starting to cause us some problem. You can see our number are dropping. But still, we maintain at around 20 1 month. For 1.5 years, we managed to treat 200 patients now. So that was in March 2001. We will soon have 300 patients in a month's time or two. So I thank all my doctor for the support. I'm going to support this initiative and development. We went to Chongqing several times and visit other centers in China so as to learn this technology. I foresee the change of gynae surgery from what we have done, the advanced laparoscopic surgery, to robotic. To some extent, some surgery will be focused ultrasound surgery. My center have been written to tell people about this surgery theater design in a private clinic. Is published in the Journal of Gynecology and Minimally Invasive Therapy. So when the COVID-19 is under control, anyone welcome to come to visit us in Hong Kong to see my center. You're welcome. You can also contact me with all this website and WhatsApp. I'm ready to answer some questions about my center. Thanks for listening.
Okay. Thank you, Prof. Felix Wong, for your nice presentation. And we open for discussion, 5 until 10 minutes. From audience, is there any question? Okay, Prof. Felix, may I have a question for you? Are you still have any laparoscopy surgery after you're doing HIFU?
Yes, quite a bit. Now, what happened is all the patients and come to you want to have the fibroid treatment. And of course, those suitable for HIFU, we do HIFU. Those unsuitable or they have other problem, and they always think, oh, but an ovarian tumor can also be treated with HIFU. So patients do come for all sorts of reasons. So our patient number did increase, many of my colleagues as well, so that we can offer them treatment, laparoscopic, open surgery, vaginal, all the surgery in addition to our HIFU surgery.
Okay. So not every fibroid or adenomasis will be solve problem with the HIFU, isn't it?
Yeah, because adenomyosis, in China, they can treat adenomyosis and find it very useful. We found that very useful as well. And however, because we rely on the insurance company to pay out. So the insurance company, one of the things they're saying that is experimental. They do not consider the China data. So because many Western countries don't have this surgery done for HIFU surgery for adenomyosis. So we have to explain and try to help the patient. It's getting difficult, but we'll try. Now I've seen a few questions is how many cases I'm going to do a day. Is that we do maximum 3 a day, usually 2. Now the reason is we have only a small space. We don't have time for the patient to rest. Usually after the treatment, they rest for 2 hours or 3 hours, and then they can go home. We don't have any hospital bed because we are not linked up with the hospital. So they go home after 2 hours. We have only 1 recovery bed. So that's the problem. But if the HIFU center is in the hospital, I think we can, like in China, if we got the patient, we can do around 5, because some of the fibroid, we can treat it with half an hour or 1 hour, 1.5 hours. It's not difficult at all.
Okay. Is there any from audience question? Raise hand. Maybe Dr. Colin Wo, any question?
I have one question here, very interesting, is that do you have any medical issues such as medical radiation leak and any leak when you have HIFU in your private clinic? Now, HIFU stands for high intensity focused ultrasound. Ultrasound do not have radiation leak. Besides, in fact, we treat more patients who have medical issue that prevent them or put them high risk for laparoscopic surgery or open surgery. For example, deep vein thrombosis. For example, a patient who have cerebral hemorrhage just years ago, and any surgery will be difficult or will have risk, especially some with deep vein thrombosis who are on anticoagulant. In fact, we are treating patients with some medical problem which open surgery will not be able to do. Okay, now if there's no further question, one question is the number of staff and the qualification. My staff we went to Chongqing to learn from them, and then we just by practice and under Chongqing guidance by remote control, and or there's doctor can come to supervise us and to see how we are doing. So many of our doctors get benefit from Chongqing sending staff to us to help us to develop the center. The qualification will be in due course, APAGE, an individual country. We are going to try to set up the training for everyone. So hopefully we'll be able to help.
Okay, Doctor, from participant is Dr. Colin Wo. You have any question to Prof. Felix?
If not, I move to my other lecture now.
Okay, I think you can forward. Yeah.
Just to say hi.
Hi, first, very nice job. Do quite a good job here, and in a very short term, you get the 200 cases already. It's not so easy. And did you have any medical legal issue in the that is in the early stage, but it's quite easy to have some complications or something? Did you in the early 200 cases, did you have any problem in the communication with the patient or something?
Very good question. And early on, despite I select the patient, I make sure all the patients are able to have the HIFU without much complication problem. I myself did have a patient who have submucosal fibroid, not a big one, but 7 centimeters. After HIFU treatment, she had continuous bleeding and could be due to infection or what. But when she went to see another doctor, she was convinced to have a hysterectomy done right away. So that's the problem, that if the patient, when we first started, I'm not so convinced about the treatment, and whenever there's problem, they go to another doctors, and other doctor won't know what's going on. That could be one of the issue. Now, in fact, we are now treating patient, even the fibroid is up to 12, 14 centimeter. So in fact, it's not difficult at all. The larger the fibroid, maybe the easier. We need to know what type of fibroid it is. So in fact, we are lucky. Besides this, for medical legal problem, I know many of the medical legal people, especially the lawyer world. So they are helping us to set up our criteria. Okay.
Yeah.
Now,
Good
so
thing. Yeah.
if there's no question, I'll start that because it's getting late, and I'm sorry that I rushed to the other lecture. Okay, there's the video presentation. Now, first of all, I must say, because due to the time zone difference, I can't have a live surgery. I hope we can, in the future, can apply surgery just like when we are doing a laparoscopic surgery. But before I begin, I may explain some of the operating system, because there are people who are very experienced and other people may just started to learn HIFU or may not have seen a HIFU system before. So I would like to just spend a little bit time to present with some operating system and what we are looking at. And also, I must say I did speed up the video so that to save time. And for those who are very experienced in HIFU, please excuse me because I'm not as experienced as you are, but just give me good comment about this case, okay? Now, I'm starting to start off showing people this the operating console, the interface we are using. And this is right side, you are controlling the transducer. This the right, the transducer will move to the right. This left, move to the left. This foot, the patient foot direction, H means the head direction. I hope people can see, but may be difficult by Zoom. A means the transducer go to the abdomen side. P means the back of the patient. And this the PZ and PZ plus. Now this is the ultrasound, diagnostic ultrasound in the center where you control whether you can see clearly. Well, this is going to divide the fibroid or the uterus into many layers so that you can ablate or burn the layer, one layer by another layer. Now, the treatment is like that. You can see the patient lie on the machine. There's the uterus. And the transducer is going to send the focused ultrasound onto the lesion you are going to see. So you burn one by one, point by point, and then when you don't think enough at the anterior, you burn the anterior as well. Usually you burn more at the back because once you burn the one anterior, it may prevent more ultrasound to go to the back. So this one of the principles we should use. We should burn the caudal side, the foot side, and then to the head, because in this way, the patient will have less pain because the sacrum is here and the lower spine is here. Sometimes the radiation heat can burn the, not burn, but causing pain on the patient. Now, so this actually how it operates. During the wheel time, you can see the ultrasound, we are moving the posterior, the transducer up. We can see the uterus over here. Now, we are going to find the fibroid, and there's in the middle. Now, usually the ultrasound is not, this ultrasound is not as good as what we are using in our clinic. We are using our ultrasound with very high resolution, but this one, after a while, you can see where's the fibroid. Now we are dividing the fiber into many layers. So each layer is around 5 millimeter. Depends on the size of the fibroid or adenomyosis, you can divide it into smaller layer. So usually we set at 5 millimeter each layer. We burn the middle layer where you have the largest area to burn and save. And then after you burn one layer, you move on to either the right or the left, and burn another layer and burn another layer until you finish. Now that's important. Later on when you see my video, you know what exactly I'm doing. What we are doing is not just one plane, but because it's three-dimensional. So by moving the transducer, you burn one layer after the other layer, either right or left. Now, however, the so-called focused ultrasound, they have a fixed focal length. Therefore, for some patient, some very obese patient, we need to make sure that the focal length can burn the lesion we want to burn, especially those posterior large fibroid. But some patients are very thin. The anterior fibroid, you might need to put a water bag so that you elevate the patient so that your focus point from the transducer will be able to focus at the fibroid. the way the nurse to learn how to use the water pad is very important because it saves you a lot of problem. Now, how do we know we have ablated the fibroid or the lesion adenomyosis we want to ablate? Now, it's the thermal necrosis of the tissue, and will change the ultrasound reflection. So this is what we call grayscale change. And the more severe necrosis, you may have the white patches. I call it white patches. There's many names for it. And you can see that is, we have burned this. So later on in the video, when you see this, you know that I've already burned the fibroid. Now, how do we know other than these white patches? Sometimes it doesn't appear, because we can only see some grayscale change. We use microbubble to be able to visualize how much, whether there's any still perfusion within the fibroid. Microbubble is very small bubble. Compared to normal bubble we have seen, it's 5,000 times less than the normal bubble. So it's phospholipid with gas inside. They travel along the capillary so that any fibroid with blood vessel capillary inside, it will be shown up by the microbubble. Just as this one, you can see this is a fibroid, big fibroid with endometrium here. And you can see the microbubble injected. And because the gas can serve as the ultrasound contrast, so that's why we can see the fibroid. Over here, we are turning from one side, the middle, to one side, and then go back to the other side, trying to assess how large the fibroid is. So you can see all this microbubble in the picture. Now, and then after we have done our surgery, the HIFU surgery, we then also inject microbubble. And at the end of the operation, you can see here, there's no more microbubble. Microbubble usually the signing you can see, and the endometrium that's still intact. I can see the microbubble still there, but in the center you won't see any microbubble. So you turn from the center to one end and then back to the other end, trying to assess how big the area you have ablated. And of course, center may use MRI after the surgery the next day, but MRI in Hong Kong are expensive, so we are using this method. One of the most important issue is the focus point we need to focus the area we burn, but make sure this acoustic pathway is without any bowel. And it's important the bowel have gas. The gas, any gas, have the ultrasound wave, and then they will heat up. And the more prolonged it is, they may burn the bowel. So we make sure it is outside this triangle. So we are burning here, could be 90 degrees. Anything over here can still be 40, 50, we don't know. So we don't want the bowel to be in between. So we always try to, some way, either distend the bladder, this is the Foley catheter, push the bowel away, or put a water bed over here to push it away. You will later on see what I'm doing in the video. Now, so the patient I'm going to present today is a 47 years old lady with menorrhagia and severe anemia. She has a submucosal fibroid of around 4 to 5 centimeters. She requests HIFU ablation after learning the HIFU ablation. And the MRI show is a submucous fibroid, as shown in the video later. Now, the preoperative blood tests are done and localization tests. That means testing whether the fibroid can be visualized, the patient any problem, this test done before the actual operating procedures. We don't want to have a patient who cannot have this surgery occupying the theater time, so that we have done everyone localization tests to test is fairly feasible to burn, to ablate the fibroid. So the HIFU ablation was carried on the last day of last month, to record it for this section. Now you can see this is MRI showing the submucosal fibroid. And we usually see a field image, T2W, and this is a hypo intense fibroid over here. So after we assess the size, assess other things, whether there's any other fibroid, and we're starting to do the procedures. Now, that's how we prepare the HIFU ablation. There's, within the theater, you can see while we doctors are discussing about the case, how we go about it, and you'll notice that there's a large television here. I allow the patient sometimes to look at it and also explain to them what I'm doing, rather than we are doing it ourselves. You can see my setup here is my infrared monitoring is over here. Now, what the nurse is going to set up, we put a frame over her buttock so that we can put the infrared camera around here. So now you can see what the nurse are preparing. Now, so put a frame there, my infrared camera just over here. So we cover it so that the patient will not look like Nick. And because we need to let the buttock to elevate the heat if it's go through the buttock. Otherwise, the patient may complain of pain, or we cannot cover them with any coating. So when the patient is ready, we are ready, then we can start to do surgery. At first, I would like to do something like with a Zoom, hopefully with this type of platform, to be able to share my operation with other people. And however, I find that it's difficult. Now, this is the setup of the HIFU when we first started using a Zoom. Now, to start with, we increase the water level so that they can cover the patient lower abdomen, because in this way, it will cool down the temperature that may be there. Now, you see in the Zoom, when we take the video, it's not clear enough. So later on, I will show you more clear pictures from some of the recording I have from Chongqing. And however, you can still see what I am doing. I'm going to explain it. And we are moving because it's not going to be so clear. I'm using a faster speed. Now, we try to localize the fibroid, the uterus, and also to see the fibroid here. Now, I will explain to you what we are doing. And then in this way, we show the Doppler to outline the fibroid. Because the fibroid usually a pseudocapsule, you can see the Doppler surrounding it. So you know that it's the fibroid you are ablating, just like in here. So you can transfer the image by pressing this button. They will transfer to here. You can take a picture, just like previously. I got a frame here. Now I'm doing a microbubble. Now the microbubble, in this one, you can see there's microbubble in the uterus. Sorry that you may not see clearly. Also, I speed it up. You can see the fibroid, and I'm recording it. And so after I see the microbubble, I can identify the fibroid is here. This is the one, the focus point. I need to lower it to here. But when I lower it to the fibroid, I find that the gas going my way. So I need to put a balloon bed, water bed over here, so that to elevate the patient abdomen, so that I can have this focus point onto the fibroid. And then I need to divide the fibroid into various layers. That's how the so-called planning is doing. So this, I identify where is the fibroid, for example, from how many centimeter to how many centimeter. So I divided the fibroid into many layers. I started from the middle layer when I'm going to ablate. So I set the temperature, the voltage to 400 volt, and then set it to hit it 1 second, relax for 3 seconds, and in this way, 5 repeat. That means burn 5 times. you can see the number of seconds you have ablated the tissue. Now, in fact, by pressing this button, it will turn red. Now, whenever the water content is too low and there's various alarms to help you, you can see already there's white patches appear. Now, in order to see clearly, I show you the video I got from, this is the video I got from Chongqing, a better recorded video. Now, again, I show you the later parts of the video. Now, so this is where the bladder is here, and the fibroid is over here. Now, so I'm changing, starting at the center of the fibroid after the microbubble, and I set the voltage to 400. You can see I press here, it turned red, so it is ablating. So it ablates 1 second and rest for 3 seconds. So that's the amount of total second I burn. So it's also recorded over here, and how many seconds I burn. And you can see after 10 seconds, there's already white patches appearing. And there's sometimes without patches, you can see the grayscale change. When you first started, I must say that it's difficult to visualize the changes. Only when there's white patches, you're starting to say, hey, we are doing it. But now you're able to see the fibroid. You can see I have moved from 4 to the other level, 5 level now. This a technique I learned from a Dr. Zhang. It seems that if I'm going to ablate the one whole area together, I need to move the machine, and that might have the bowl in between. So instead of moving to the front, I burn each of the layer at the posterior caudal bit first. Now I move from the 4th now to the layer 6. So when I see the ablation is more or less enough, I move to another layer. There's another layer, I'm moving. So when you move the other layer, there's not much white patches. And the more you ablate, the more you're able to see. Now, this is the one after ablation, but there's already too close to the edges of the fibroid. We are told we probably don't go to the edges of the fibroid because this one, remember, is submucosal fibroid. We don't want it to burn too much into the endometrium. So we are moving from 4 to another layer on the right side. This is the right side at the level 5. So all at the posterior. And so at the caudal end, we want the heat to spread to the south or to the abdomen direction and to the front. You can see weakly the fibroid. Now I move to another layer at the side. So after burning, you can see it's quite obvious, and the fibroid is starting to have all these white patches or grayscale change. This is, if they are not white patches, sometimes you can see grayscale change, and you can see this is the fibroid. Now, but I admit that this one, I am hitting it a bit too low. I need to burn, the fibroid is larger than this, so I need to move on. So what I did is try to identify the location, the size of the fibroid by the Doppler. So that's what I have just done. But you can see more or less the fibroid I can see is, other than the posterior, is not enough. So that is the whole fibroid. And I use Doppler to identify it as well to help me. And then the front, it still needs some ablation and the top a bit. So I try to relocate the water bed in this way to push the bowel away. So you can see the water bed is more moved to the caudal end. So I moved the pointer, the focus, to more to the caudal end so that I burn deeper. And this way, I managed to ablate the whole fibroid. I would say could be 100%. But when you see, when we have already white patches in front, it's more difficult to see the changes at the back. But still, you are delivering some energy over there. So it still burns the fibroid. Later on, by microbubble, you can see the appearance of the non-perfusion volume. So I'm already moving, trying to burn. It seems that it doesn't move. And so a middle first and move to the side. So, and this is again, further on, I just give a few heat at the middle of the fibroid. Because every time we put the water bed, sometimes the uterus can be moved a little bit. So that's one of the problem. Sometimes we need to be able to see what we are ablating and how large is the fibroid. And now, when we think we are more or less finished, then what we are going to do is to inject microbubble inside again. So there's going to wait until one thing is you can see the fibroid and being burned. There's over here. Now this is the microbubble. Now one thing is we are using oxytocin. You can see there's no perfusion in the fibroid. So I'm turning it from one side to another. When I measure the size, it corresponds to the size of the size of the submucous fibroids in the MRI. So I usually compare here and the appearance, and so before and after. So, and I use again the Doppler to see, to outline whether this is the real fibroid I'm treating. So that's how I finished this case of a 5 centimeter fibroid. So I managed to complete the procedures in 30 minutes for this submucous fibroid, and the patient recovered well 1 hour in the clinic. She was discharged home with analgesic, just some painkiller. She remained well and come back to follow up in 1 week's time. And her fibroids already show shrinking in size from 4.5 times 4 centimeter in the MRI in this pictures to 3.1 to 3 centimeter by ultrasound. So she did not have any side effect or complaint. She will be visited again in 1 month and in 6 months' time. And we believe that this size of the fibroid, if it is effective, it probably disappear within a year. So hopefully her menorrhagia and all that will be will be under control after 1 or 2 bleeding. Now, that's the whole for the presentation. And I choose a case, not a difficult one. Unlike our laparoscopic surgery, we usually show the skill we have for difficult one. But because of the time limitation and otherwise it can be very boring. But there's quite a lot of technique we need to learn. So especially for multiple fibroids or adenomyosis. So this is just a simple case for me to present. Thank you for your attention.
Okay, thank you, Professor Felix. Maybe one question from audience? Okay, one question for you, Felix. Is there any contraindication for the HIFU?
Yes, in some big fibroid, especially MRI, the T2 weight image, if it's hyper intense, that means they're quite vascular. Then it's very difficult to ablate. It may take too long a time. And we usually make sure that oxytocin can control enough. Now,
Okay.
of course, the other major indication is that any suspicious of is now myosarcoma or any lesion with possible malignant change. We need to be very careful. Now, some position of the fibroid are not easy to ablate, and some may be easy for laparoscopic surgery. For example, a pedunculated fibroid. Okay, so otherwise it will be, yes, we can ablate it. It takes a long time to become regress. The lump is still there. So now, in fact, we can ablate nearly up to 90%. Patients will come to us. So the rest depends on the level of the skill. So I myself set up the fibroid into various levels of skill, just like our laparoscopic surgery, so that hopefully our doctor will learn the skill from one level to another. But unfortunately, it's not that easy. We use just one section. One question is, how many sections are used for large fibroid? The machine from Chongqing is very effective. If you do well, we just use one section. We don't have to use the other section, even for 12 or to 14 centimeter fibroid. And of course, why people asking this question, especially the insurance company, because there are some other hyperthermal machine. They are not as effective as the machine we are using from Chongqing. That's why they may need several sections to avoid the skin burn and other not effectiveness. Then they need to use several sections to do it. Now, one question I can see is the HIFU in degenerative fibroid or degenerating fibroid. Yes, we have many fibroid. They are large. They also have area of degeneration. But degeneration may offer problem when you hit at it, but we are using the MRI to guide us as well. And we can know where the degeneration, but it still can be done. And the degenerative area already is not going to grow. So it doesn't really affect your result too much, but it may take a long time for it to regress. Okay, so yes, we can do it. And so the courses, provide any course for HIFU. Yes, APAGE and many of our center, we are trying to set up some training program together with Chongqing HIFU and some center in China. It's going to hopefully provide training course for people who learn HIFU, how to do it. And in fact, the International Society of Minimally Invasive and Virtual Surgery Society do have quite a lot of teaching on the web. People can go to the web to see many of the teaching from this society website. So, okay, any other question I may see? Yeah, I think more or less the question I've answered. Any other question?
I think it's
Oh,
already.
one question is what kind of complication or HIFU procedures often occur for beginner? Now, for beginner, you know the limitation, just like laparoscopic surgery. I think HIFU surgery should be trained, not just by observing more, but to do it under supervision, under good supervision. So in this way, we'll minimize the complication. Besides this, I mean, there are fibroid that can be, or adenomyosis that's difficult to do. And for example, posterior fibroid, large fibroid, anything more than 8 centimeter, multiple fibroid. And so we should have various level of skill to learn and various level of fibroid. But unfortunately, we may not be able to divide so closely different type of fibroid. Okay, and I think that's all. I'm getting too late now, I believe.
Yeah. Thank you, Professor Felix Wong, for your nice presentation and discussion. And I think we has already the end of the webinar today. It's very interesting talk about HIFU, and also and then give time to Dr. Selva to close the webinar. Please, Dr. Selva.
Thank you, Dr. Relly. So thank you for attending this webinar. Our next webinar on APAGE and the International Society of Minimally Invasive and Virtual Surgery HIFU webinar will be held on the 26th of August 2021. And you can see the program there. There will be talk by Professor Chi Rui Zeng from Taiwan on challenges of myoma, uterine, and adenomyosis in fertility management. And Professor Felix Wong will be speaking on why HIFU is the option for treating uterine myoma. So please join us to attend this webinar again in August 28. The more you listen to it, the more you will understand how HIFU will be one of the armamentarium of methods that we can use to deal with uterine fibroids and adenomyosis. And what has been said is that we cannot use HIFU for all our patients, for all the treatment, but in some patients, it is a very useful modality of treatment. So with that, I conclude this webinar. Okay, thank you very much, and see you again in August. Bye for now.